Welcome back to the Coffee Hour. I'm Andy Bates. Sarah's away today, but we have another Sarah here today. We have Sara Correnti, Manager for Health and Welfare Member Wellness Products at Concordia Plans. Sarah, welcome back to the Coffee Hour.
Thank you.
It is good to have some time to chat with you. I know we have some updates to chat about, particularly for resources for Concordia Plans members, right?
Yeah, the health plan members specifically. Yeah, we have a program that we've had in place for a number of years, but over the years we've added new things to it. And then there's some newer things that people are going to be seeing this year with it. So yeah, just wanted to make sure everybody knew about it.
Okay, very good. So this is Grand Rounds, right, that we're talking about today?
Yeah, as of today, it is Grand Rounds.
As of today. So that sounds like there's a name change coming.
Yeah, sure is. Yeah. Okay, we'll just get to it. Yeah.
So
there's a change coming.
Tell us what is Grand Rounds, or the new name. It has a new name?
It will have a new name.
Okay.
Yeah, right now its name is Grand Rounds by Included Health, which is that kind of transition name for people to start to get used to this new name, the new appearance. It comes after they merged with another program, Doctor on Demand. So they wanted to put it all together and make it, kind of one cohesive brand. So it will be Included Health. So Grand Rounds is going to still be that personal assistant kind of aspect of their program, and then they'll have their telehealth program. So Grand Rounds, it's the same program that people know and love, that we've added different services to our members over the years. But we've seen a lot more people using it in the last year or two, which is amazing because, with COVID, healthcare has just been hard, right? Of all of the other things that have been hard, but
a few things that are hard.
Right. So why not healthcare as well? Which it was already pretty hard, right? It was super tricky to navigate. And when we first started with Grand Rounds, they were a great doctor match service. So you could get matched to a really high quality doctor that was going to give you really great service and really great care. They're usually doctors that are in the 10% or higher of their scope. So we knew that our members then would be getting good quality care. But then we went on to expand beyond that to really help with that healthcare is hard problem.
And you used, I think, the really key word earlier when we were talking about it being hard, particularly to navigate.
Yes.
Navigating, thinking about not just myself, but even for my parents too, trying to navigate healthcare for themselves today, all the things that have changed. Just think in the last 10 years, how many things have changed. And so trying to navigate healthcare and having a resource to help you navigate it, I think is very helpful.
Yeah, it is super helpful. Just going back to that first service that we were able to give our members through them, finding a doctor, right? How did you used to find a doctor? Probably would ask around.
Well, I'm much older than you, so
get the yellow pages.
Get out the yellow pages and look through the phone book to try to find a doctor. But then trying to find a specialist, you would go to your primary care, which I don't even know if we used that term back then, but you go to your doctor, and then they might recommend a specialist, and you have to have a form for that, and then you go to the specialist. Yeah, it was
a lot of work, right? So you really had to be motivated in whatever you're trying to take care of. But then there's still limitations to it. Your primary could be very well intentioned, but they don't know that this endocrinologist maybe isn't really as good as this other one over here. And when a doctor isn't performing, or really any provider isn't performing in that higher level of their scope, then they could be seeing their patients more often, which costs us as members more money out of our pocket for co-pays, or there might be more unnecessary medication changes or imaging, or all the things that add into the cost of healthcare that doesn't impact just the bigger picture, but your own pocketbook. So all of this is designed to help have higher quality care where it's controlling the costs across the board for whoever's involved in the healthcare, and making sure that there's going to be the better clinical outcomes then from it too.
So how does it work? How does a member use Grand Rounds by Included Health?
Super easy. You can either use the like internet-based program, so going onto your computer or in a web browser. But they do also have an app that is super kind of like tile, like click friendly. Half the time when I use it, I don't even know what I'm supposed to be clicking on, so I just type something in like the search area, and then all of the programs, algorithms or whatever data people call it, it can kind of predict what it is that you're looking for. So endocrinologist, as an example, if you were referred to one and you wanted to check how good quality one was, you could type in that doctor's name or just type in endocrinologist and they'll match you with high quality ones, but then also recommend to you anything else that you might have with the health plan related to endocrinology, like any of our diabetes programs. So it's really kind of pulling together all the parts of your healthcare that you might not be aware of. So that's how it's acting like your personal healthcare assistant.
So how might it be helpful for someone, say, who has a new diagnosis? They're going to the primary care, they got a new diagnosis, maybe it's something diabetes.
Yeah.
They're going to the primary care, new diagnosis. How would Grand Rounds by Included Health be helpful for them?
So couple things. Maybe they haven't met the endocrinologist yet, so they could get that. Maybe they have, and maybe they're just not sure. Like, they talked about a whole bunch of medications and they're really kind of confused. They could go to Grand Rounds. They have a feature called Treatment Decision Support. So you can talk to a clinician of sorts, whether it's a nurse or a pharmacist or something like that, and get those questions answered. Because, it's not always easy to get a hold of somebody at a doctor's office nowadays. So they can guide you in what the medication does, maybe what side effects might be, other questions to ask, or maybe there's other medications. Or going back to, like, you're just not totally sure about the treatment itself. So say maybe not so much diabetes, but your doctor said surgery is the only option you have left for your bum knee. Well, if you're not really like, oh, I don't want to jump right into surgery, Grand Rounds can actually do a virtual second opinion for you. So you can contact them. They will go out and gather your medical records from any doctors participating in your care. And then their doctors will review your medical records and then either say, this is the best treatment. Oh, maybe they missed something. You should try this first or whatever. All without you having to do anything. They'll do all of that for you. No extra visits, nothing like that. So you can either get that affirmation or that guidance to another opinion for your care that maybe is less invasive or maybe not quite so risky or just not something that you're ready for. So they're really there to just kind of check all the boxes for you.
Sounds very helpful. So new features. You mentioned that they recently merged. Grand Rounds recently merged. Are there new features or new features on the way?
So not that we can really talk about yet. The Doctor on Demand thing is public, but our members won't have access to Doctor on Demand through Grand Rounds. That's reserved for our Blue Cross members through Blue Cross. So that's a whole other thing. But that whole kind of, I don't even know the difference between a merger and acquisition and all the... However they came to be, they're now together. That is kind of like a new kind of path in what they're all doing. So we're really excited with what they could do, and we're really happy with what they've been able to do for our members over the last year. So just in the fall, we had so many new people register for Grand Rounds and so many people using it that when we asked, how many people use it this month, like we ask every single month, they actually kind of stalled for a little bit because they thought the numbers were wrong. There was just this sharp increase in the number of people using it, which great. People are becoming those advocates for their healthcare, and they're reaching out and having those questions like, is this the best care for me? Which is a huge change, I think, in healthcare, because it's hard and it's intimidating. So for people to even ask the questions is a huge victory. What do we need to know? What are the things that if you haven't signed up for, haven't used Grand Rounds yet, and you're a Concordia Plans member, what do you need to know to make use of it? First step, sign up. Then we'll be able to more easily keep you updated on what's coming or maybe what's relevant for what's going on. Like the treatment decision support that I talked about. That was wildly popular, especially early on in the pandemic, because people had easy access to a clinician just to say, what is going on? Do I wear a mask? Do I not wear a mask? What do I do? So that's important for them to just get registered, and then that way they can stay up to date so that they're reminded that they have it when they need it, because this isn't something that you maybe need every single day. Doing that, registering for those that are jazzed about vitality points, that'll get you vitality points.
I was going to point that out.
Yeah, it's always there. So if that's your one reason to do it, then do that. But then to know that you have this host of services. So if you think of Grand Rounds as that, like I don't know who to talk to. I don't have like a healthcare advocate. Just go to them. You can ask a question. You can compare doctors. You can do all of the things that you just don't always have like one sole source of good sound information for. We're able to trust Grand Rounds to do that for us.
So even if you have questions, trying to figure out what kind of specialist to go to, even you can work through Grand Rounds to use the resources to figure that out.
Yeah, absolutely. Just a little of my story. I've had a ton of neck issues that have progressively worsened over the last 6 months, and I had some opinions from one doctor, and I was kind of like, I don't know if I agree. So I was able to go to Grand Rounds. I was able to get another doctor and really just kind of work through them for all parts of this. When I had questions about which doctor do I believe and, what are these treatments that they're talking about, it just really helps to answer all those questions that you maybe don't think of when you're in the room. And how hard is it to get in the room with the doctor anymore these days? So it's that in your pocket kind of personal healthcare assistant to just always be there for you, whatever kind of question you might have or whatever kind of service you need connected to.
Very good. So how do members of Concordia Plans find Grand Rounds?
Good question. They can go to concordiaplans.org, and under the member My Wellness Benefits page, it's right there at the top with our Health Connector, or they could go directly to grandrounds.com/Concordia Plans.
Excellent. Very good. Anything else we should be on the lookout for? Any other news from Concordia Plans?
Oh, we always have stuff going on. Lots of great things that we have in store to take, good care of our members and our ministries this year. So stay tuned. I'm sure I'll be able to come back soon and share more stuff with you.
Very good. And I'm sure we'll have some recipes to share in the future. By the way, how did the cinnamon rolls go at Christmas?
Oh, amazing. Yes. Yeah, gone in a day. It's weird how apples don't go like that at Christmas, but cinnamon rolls, yeah.
Cinnamon rolls,
they
yes.
were great. Yes.
Sara Correnti, Manager, Health and Welfare, Member Wellness Products for Concordia Plans. Thanks so much for being my guest on the Coffee Hour today.
Thanks, Andy.
The Coffee Hour with Andy and Sara is a production of KFUO. To support the Coffee Hour and KFUO Radio, visit KFUO.org. You can also text KFUO to 41444 or send an email to gifts@kfuo.org. And you can call us at 800-844-0524. KFUO. Christ for you, anytime, anywhere.